Clinical Practice Guidelines for Coronaviruses Management. Coronaviruses are a large family of viruses that cause illness, from the common cold to more severe diseases such as Middle East Respiratory Syndrome and severe acute respiratory syndrome. The novel coronavirus, COVID-19, is a new strain that has not been previously identified in humans. Initial human infections of the novel type of coronaviruses were acquired from exposure to animals. COVID-19 can spread through droplet transmission, and the incubation period is from 2 to 14 days. The disease can be mild, severe or critical with different clinical presentations. Severe disease may occur in people with comorbidities such as cardiovascular disease, diabetes, chronic respiratory disease, hypertension, and cancer. The clinical presentation varies in severity from asymptomatic infection to mild illness to severe or fatal illness. It may include fever, cough, myalgia, and shortness of breath. Other symptoms include sore throat, headache, cough with sputum production, and/or hemoptysis. Complications are rare in people with no underlying medical condition. In vulnerable population, the complications include respiratory failure, septic shock, and multiple organ dysfunction. Fatality rate with COVID-19 is only 0.9% for people with no underlying medical condition. The diagnostic tests include assays for genes N, E and RDRP. The common laboratory abnormalities found include leukopenia, leukocytosis, lymphopenia, elevated alanine aminotransferase and aspartate aminotransferase levels, and thrombocytopenia. Chest CT images may show bilateral involvement of the lungs. There is no specific antiviral treatment recommended for COVID-19, and no vaccine is currently available. The treatment is symptomatic, and oxygen therapy represents the major treatment intervention for patients with severe infection. Mechanical ventilation may be necessary in cases of respiratory failure refractory to oxygen therapy, whereas hemodynamic support is essential for managing septic shock. Measures for prevention include avoiding close contact with subjects suffering from acute respiratory infections, washing your hands frequently, especially after contact with infected people or their environment, avoiding unprotected contact with farm or wild animals. People with symptoms of acute airway infection should keep their distance, cover coughs or sneezes with disposable tissues or clothes, and wash their hands. Individuals that are immunocompromised should avoid public gatherings. When handling suspected cases, the clinician should place a surgical mask on the patient and keep them in isolated rooms. They should contact and follow advice from local public health unit on the exact specimens required for specialized testing, the approved collection methods and equipment for collecting specimens, and the protocols for handling, storage and transport to correct laboratory.